Hello and welcome back. My name is Jack B. And as always, thank you for viewing my video. The topic of this video is disease and virus resurgence in the U.S. Many of these contagious diseases are serious and can cause weeks of illness. Some are also antibiotic resistant. There are several respiratory illnesses such as influenza A, H3N2, COVID-19, including the cicada variant, and RSV circulating in the U.S. In addition, tuberculosis rates are rising after 30 years of decline. Other increasing threats include drug-resistant Shigella, measles, and mosquito-borne dengue. Influenza A, specifically the H3N2 variant, caused significant illness early in 2026. COVID-19 continues to circulate with new variants. RSV, respiratory syncytial virus, remains high and is trending upward in several states. After 3 decades of decline, TB rates are rising in the U.S., with recent outbreaks reported in high schools and several states. The CDC has warned of increasing cases of highly antibiotic-resistant Shigella bacteria, which causes severe, often bloody, diarrhea. Multiple measles outbreaks have been reported in 2025 and 2026. Local transmission of dengue fever is increasing in certain U.S. areas. There are also reports of rising cases of Mpox, formerly known as monkeypox, E. coli, and avian flu. Declining vaccine compliance for diseases like measles has raised public health concerns. XDR Shigella is growing because it resists commonly used oral antibiotics. Increased travel and climate changes are contributing to the spread of mosquito-borne viruses such as dengue. One can consult the CDC current outbreak list for the most accurate and up-to-date data on local outbreaks. 3 months into this year, and the U.S. is experiencing a significant measles surge. There are already 1,714 confirmed cases reported in the U.S. as of April 9, 2026. In 2025, there were a total of 2,287 cases reported. The 2025 number was the highest number of cases reported in over 30 years. It was driven by low vaccination coverage and outbreaks in 33 jurisdictions due to a lack of vaccinations in those jurisdictions. Over 90% of cases are in unvaccinated individuals. This surge threatens the U.S. measles elimination status. This rapid surge in April 2026, with 94% of cases being outbreak-associated due to no vaccinations, means 2026 is on course to significantly exceed the 2025 total cases. While there were 3 deaths in 2025, so far there have been no deaths in 2026. Currently, major ongoing outbreaks are concentrated in Utah, with over 400 cases, and South Carolina, which is the primary source of cases. There are also a significant number of cases in Texas, approximately 176, Florida, approximately 144, Arizona, and California, notably in Sacramento. Most cases are due to unvaccinated individuals who are linked to 17 active outbreaks across 33 states. This year, 2026, 73% of the cases are in children and young adults up to 19 years of age. There are 96 hospitalizations, which is approximately 6% of the reported cases. The outbreaks are occurring in 33 states and New York City. Recent trends for reported measles cases in the U.S. do not look good for the future. In 2020, there were 13 cases reported. In 2021, there were 49 cases reported. In 2022, there were 121 cases reported. In 2023, there were 59 cases reported. In 2024, there were 285 cases reported with 16 outbreaks. In 2025, there were over 2,287 cases reported. This number set a new record high since measles elimination in the U.S. In the first 3 full months of 2026, there have been 1,714 confirmed cases reported. We are on the road to a new record. Third world countries usually have these numbers. I guess from a health point of view, we are on a parallel status to a third world country. There are 3 basic causes for this increase. Number 1, declining vaccine rates. The U.S. MMR vaccination rates have fallen significantly. Many areas are well below the 95% coverage needed for herd immunity. Number 2, vaccine hesitancy. Misinformation, confusion from the federal government, and increased resistance to vaccine use have led to fewer children receiving their recommended doses. Number 3, international importation. Widespread travel and global outbreaks have increased the number of cases brought into the country. As I understand it today, the CDC recommends children receive 2 doses of the MMR vaccine. The first dose at 12 to 15 months of age, and the second dose at 4 to 6 years of age. Public health officials urge unvaccinated individuals, especially those traveling internationally, to get vaccinated immediately. The CDC asserts it is actively trying to contain measles outbreaks by deploying specialized teams to impacted areas, such as South Carolina, strengthening vaccination programs and distributing vaccines. The federal response focuses on maximizing measles, mumps, and rubella vaccination rates, tracking cases, conducting contact tracing, and providing guidance on post-exposure prophylaxis to curb transmission. The CDC recommends that all individuals, particularly those traveling internationally or in outbreak areas, stay up to date with 2 doses of the MMR vaccine. The CDC is providing laboratory support for rapid testing and genomic sequencing to identify cases. Disease detectives on field support have been deployed to hotspots to assist local health departments with investigation, mapping, and implementing control strategies. Health officials are providing post-exposure prophylaxis, MMR vaccines, and/or immune globulin to exposed individuals within specified timeframes, within 72 hours for vaccine, and within 6 days for immune globulin to prevent and/or modify illness. The CDC and local governments advise isolating infected individuals and quarantining unvaccinated contacts. The federal government claims they are addressing misinformation. Federal partners are engaged in public awareness campaigns to share evidence-based information on vaccine safety. Recent drastic changes to U.S. vaccine policy, including altered recommendations and reduced funding by the federal government, have created significant public confusion. Conflicting guidance on COVID-19 boosters often contradicts professional medical groups. It has caused access issues at pharmacies, with 15 states suing over new, narrowed vaccine schedules. Public confusion is exacerbated by a highly polarized environment where 52% of people report not knowing enough about mRNA vaccine safety to make an informed decision, leading to inaction. Some individuals have faced issues accessing vaccines due to conflicting guidance. The legal authority to manage vaccine mandates for school attendance remains with state and local governments, not the federal government. It is unlikely that insurers will fully cover or keep no-cost coverage for medications or vaccines not recommended by the CDC or its advisory panel, particularly if they were previously covered under Affordable Care Act mandates. When a vaccine or medication is removed from the CDC recommendation list, it often loses the mandatory no-cost coverage status provided by insurers. Also, FDA approval is necessary, but it is not sufficient for coverage. Insurers often rely on, and sometimes only pay for, treatments recommended by clinical guidelines from the CDC. If a drug is approved by the FDA but used in a way not recommended by the CDC, then coverage is possible but not guaranteed, and often requires prior authorization. In summary, the U.S. is experiencing a surge of various diseases which can rage out of control if proper vaccination, medication, and containment is not provided and taken. The CDC, acting under the direction of the federal government, in addition to having unqualified leadership, is causing widespread confusion and distrust among Americans in the healthcare system, which is putting their health and life at risk. With all the changes that have occurred, many people might not be able to obtain the proper medication because it might not be covered under their insurance. In the meantime, I will continue to maintain good hygiene, common sense, and get my vaccinations. Well, these are my thoughts for today. And again, whether you agree or disagree, please verify the information presented. Thank you. And until next time, take care and be safe.
No, Kevin. Me na do it.
Ooh.